These are in listen-only mode.
Well, good afternoon, and thanks for joining us, even though it's a few days before the holidays. This is Michael Gordon, along with Alicia. Hi, Alicia. How you doing?
Good, how are you?
I'm good, and listen, today we have a topic, as always, this time about rejections, and it's actually continuing on from some of the topics we've had recently. Just to remind you, we cover our main topic and then just open up the floor to any questions that you might have. You have two options. You can hit the little question mark button and icon and type it, and we should be able to see it. Or you can raise your hand and we'll open so you can just talk if that's easier for you. And so these are recorded. If you have some folks in your office who might stand to be able to listen to this webinar, you can just go to the page you registered on and click, and it will be, you have to give us about a half hour, but it will be there. And I will always make at this juncture the request that if there is something that you'd like to hear about, a topic, something you've heard about but would like to know more about, it would really be good if you let us know however you did that, because clearly it's more helpful to you if we talk about things you're interested in. So with that, we are indeed moving on to today's topic, and that has to do with working on these provider segment rejections when you get denials for electronic submissions. If we don't hear from you directly about a topic, we pick it based on our support tickets and what people seem to be struggling with the most. This is definitely up there in the great pantheon of things people ask about. And so, Alicia, help us. Tell us about provider segment rejections.
Thank you, Michael. So today we're talking about provider segment rejections. The rejections that we've been talking about have been very, very general in the previous webinars that we've had. So I recommend that you take a look at those webinars before you look at this one. And today we're digging a little bit deeper into a specific type of rejection, the most common rejection that we see when we're first implementing a new EHR, and that is the provider segment rejections, including the billing, rendering, and referring provider segments. So today we're going to look at one of those rejections, or an example rejection from one of our clearinghouses. We're going to look at configuring your insurance company's settings, MPIs, and tax IDs accordingly, and then we can look at how to make corrections to a rejected batch and resubmit. So first stop along this journey today, we're going to look at the example rejection, which you see here. And you can see that, again, what I've told you is providers and clearinghouses all give you different rejection messages. So yours may look a little bit different than this one here, but this is just an example of what you might see, missing data. So in this case, the NPI is actually missing from the claim. So we're going to go over to ClinicTracker and we're going to take a look at a few things. So here in ClinicTracker, we're actually going to click here to go into BillingTracker, and we're going to look at our insurance company settings first. Okay, in BillingTracker, we're going to click here to go to settings, and then here where it says insurer plans. This is where all of your insurance company's specific settings are configured for their claim values. Today we're going to use Blue Cross Blue Shield as our example, and here on the electronic claim options tab, we're going to look at the NM109 priority settings, also known as the provider segments. Under these NM109 provider settings, you'll see that we have a space here for the billing provider, the rendering provider, and the referring provider. Each of these have their own individual options next to them. What you have selected here is going to impact what actually goes out on your 837 EDI file, which is your claim batch. Here, where it says the billing provider MPI, you have several options here, and I'm just going to press F2 on my keyboard. That opens up the drop-down search list. So you can see all of the options here. So we have several items to choose from, the first one being provider. If you select provider here next to where it says billing provider, that means that the staff member selected on a claim will be used as the billing provider, and whatever NPI number you have configured for that staff member is going to go out in the billing provider segment. If instead you select appointment location NPI, the system is going to use the NPI from the appointment from the building that you have selected on your patient contact record. So we're going to walk through that in just a second. Again, appointment location instead, this time tax ID. So again, it's going to be the tax ID from whatever building you have selected on your patient contact record. This one is just a little bit different. Instead of using the specific appointment location from the appointment record, we are going to use a main building. Whatever you have configured in your building input form as the main building, the system would always use that building's either NPI or tax ID number. And then finally, you have the option of none, which quite frankly, I've never seen anybody use. Okay, so let's start right back here at the top at provider. If you use this option, that means you need to have an NPI number configured for whatever staff member you have entered on your patient contact record. So let's go back to ClinicTracker and take a look at that. Does anybody have any questions before I move on? Michael, are you pretty clear so far?
Well, actually, I do have some questions, and I'll give people a chance to ask them if they have any.
Okay.
So just going back to that, to the rejection notice. So that rejection notice told you that the batch was rejected because there was an NPI missing, but because there's not really standardization across insurance companies, et cetera, you don't know from this what that's about. You just know that somewhere in the options for an NPI, something's missing.
Correct. And actually, the most useful piece of information in all of this is right here, where it says the 2010 AA.
And why?
If you recall from our EDI training webinar, which again I recommend everybody take a look at, we know that electronic claim files are made up of loops and segments, and when I look at that 2010 AA, it points me to the specific area of the electronic file that is failing. So when I look here at my ANSI reference, I can see here the 2010 AA is the billing provider name. What would be even more helpful in that particular rejection would be if it said which element in this segment was failing, like the NM 185. Or the ref EI, for example, then we would know exactly what was missing or failing.
Okay, so when it says billing provider name, that can mean actually the NPI for the location that billing provider is at based
Right.
on the license, et cetera.
Right, and so while we can't tell you how to specifically bill claims for each individual payer, you know, your billing experts will help you out with the payer-specific requirements, and of course they can reach out to the payers if there's ever a question. What I can tell you is what we typically see most often in this billing provider segment, we're seeing the clinic information go out. So if you had clinic ABC clinic, that would be the billing provider name, and the NPI for that clinic would go out. So that's typically what we're going to see in that billing provider loop, whereas in the rendering provider loop, we'll see the individual clinician's name and NPI.
And the difference between billing and rendering?
Well, the billing provider is whatever agency is hosting the service, if you will. So if you're an individual provider, you might see your name here, your NPI here, and then in the rendering provider segment, you would see identical information, and that, you know, that would be more typical for an individual provider.
All right, so just one more thing, and I'll let you get back to your your presentation. I guess I'm missing a step here. So you have that rejection. That rejection does tell you who the patient is that got rejected. If you were to look at this.
Yes, yep, we've removed patient-specific information, but that was right along the top of the rejection notice.
So I guess I don't quite get, so you knew who the billing provider, who the patient was for whom the MPI information was missing, but then you went to BillingTracker to the insurance to see what was going on there. Wouldn't you want to just go to whatever you submitted for that patient and see what was missing?
No, and I'll tell you why. So my first thought when I'm personally troubleshooting a rejection like this, my first thought is, what are we sending? What is the system configured to send in that area of the claim file? So the first thing I'm going to do is, you know, in this I generally would already know who the payer is. So I already know which insurance company rejected the file. So I'm going to come in here, go to Settings, Insurer Plans, and then I'm going to know that Blue Cross Blue Shield Excellus is the rejecting payer. So I want to know what we're sending over in the billing provider segment, and that in this case right now is the provider information. So then I would look at the claim. So let's say we're going to use one of our example patients' claims here. I'm just going into the manage accounts or billing accounts, so, most places are calling it now. So in here, here's the claim that rejected. Bruce Boss is the billing doctor. So here's the provider that's going out on the claim. Now, knowing the provider that's being sent on this claim, I can make sure he has an MPI configured on his staff info record. So in this instance, sorry?
Well, so in a way, what you're telling me, which makes a lot of sense, of course, you're telling me that if one particular patient's information is messed up, that's because the system in that regard isn't set up correctly, so it would affect that patient or any other patient.
Right. Yes. And it really depends on which piece of this puzzle isn't configured correctly. So in this case, you know, if we're sending the provider information, we would need to make sure the provider is completely configured or configured correctly. So we would do that by coming over here to ClinicTracker, going to Staff Info. On this form, we're going to use the binocular button, and then come here to where it says Bruce Boss, because that's the provider listed on the claim, and we see that this is an invalid MPI number, and that's probably why the file's rejecting.
Okay, okay. So the thought is, don't try to fix an individual patient's claim, go back and find out why it got messed up to begin with in terms of how it was set up in the system.
Correct, because once you make that correction for this provider, all of this provider's claims can now be recreated in the system and they're automatically corrected.
I got it. That's helpful. Thanks.
Sure. So let's go back and we're going to look at a different setting, and this time we're going to say that the setting is the appointment location. So again, we would come in here to Settings, Insurer Plans, select your insurer. Here under the eClaim Options tab, this is where you're going to see either the appointment location MPI or the main building MPI. Either of those selections, and of course you have the tax ID numbers as well. I just don't see those used quite as often. So in this example, we'll say appointment location MPI, but either the appointment location or the main building both come from the same place. Okay, so just going back to our claim, we're going to go to Manage Accounts, pull up that patient. Okay, and we see that the location is in home, and we can see that right here, or we can double click on the claim to find that out right here. So we want to check the configuration of the in-home location. Okay, so we're just coming back over here to ClinicTracker. And then going into Utilities, Maintenance. On the maintenance menu, we're going into the building/billing location input form. It's the third item down, and we're looking at the in-home location. because that's what was listed on the appointment. And here we see there's no MPI number. So again, that would cause a rejection. So if instead of appointment location, you were just using the main building, you would look in the same exact input form, the building input form, and you would look for the item that has a check mark here. Whichever item has the check mark, that item would always be used no matter which appointment location had been selected on the patient contact record. Is that making sense so far?
Yeah, it does. Yeah,
okay.
It does.
Okay, and I don't see any questions from the audience yet, so I'll just keep moving on. But if you guys do have any questions, go ahead and raise your hand. We can unmute you, or you can type in your question and I'm happy to answer them. Okay, so now that we've made, we'll say that we've made our corrections to either the staff info form or the building input record, now we need to go into the BillingTracker system and recreate the claims. Okay, so you'll know which claim batch rejected. You'll come here knowing that you've made the corrections on the ClinicTracker side, again, either in the staff info form or the building input form under the maintenance menu. You've made those corrections, you've saved your changes, you're going to come here to BillingTracker, Review Submissions. Under the Review Submissions, you're going to adjust these settings right here at the top to meet the date range of your particular file and the claim type, or in this case we want an electronic batch. Okay, once you have adjusted these items, you're going to click Retrieve Submissions. You'll use the drop-down box here to select the batch number that was rejected. Okay, so once you have your batch number, or excuse me, your batch selected here, you can go ahead and click the Requeue Pending button. That's going to requeue all of the claims that were in that batch. So automatically you're correcting everything that was included in the rejected batch file. Okay. After you requeue your batch, you can come here to Claim Management, and then you would process your claims as normal. So typically speaking, to process an electronic batch, you would come in here to say Queued Claims, Electronic. You'll adjust your date range as normal, and again, because I'm on a demo system, I always expand my date range pretty wide. And then those queued claims are just going to come back as your with your results with all of your normally queued claims, and you would just batch them all up and send them out. Okay. Any questions on how to requeue and rebatch the claim files?
That seems pretty straightforward. I mean, essentially you're correcting what's missing and then having everything go through again, and hopefully that works.
Right. Yep. And again, on these rejections, if you don't know specifically what the payer is saying failed, you're going to want to look for a number like this, and that's what you're going to want to communicate to the support team. So we're looking for this whole error message so we can see all of the information, even if it kind of looks like gibberish to you. It could be meaningful to us. So send us those complete rejection messages if you need assistance.
Okay.
Okay, so I don't see any questions from the group, but as Michael's wrapping up, if you do have questions, go ahead and raise your hand or type them in, and we'll certainly address them. So Michael, back to you.
All right, well, thank you. I don't see any questions, and so we will wrap it up. We'll be notifying you of the next webinar, series of webinars after the first of the year. And obviously, in the meantime, if you have any questions, you know how to get us through support. And again, let us know if you do have some topics you'd like us to cover. And I hope you all have a very, very happy holiday, and we'll talk to you after the first of the year.
All right.
And of course, very much to you as well, Alicia. Take care. Have a good holiday, okay?
Thanks, everybody.